It's now the law, and it has a dramatic impact on all of our lives. The Affordable Care Act, often referred to as Obamacare, has transformed the way we get health insurance. The changes can be confusing and they can be frustrating. It is certainly controversial. For some of you, costs have already gone up. For others, they went down. Welcome to our new healthcare landscape. So here it is, folks. 906 pages in all of the Affordable Care Act. About the only thing I think we can agree on is this changes healthcare. We're not going to debate whether this is a good thing or a bad thing. But I'm wondering, Jim, if you can tell us, as simply as you can, what this really does for us. What is its impact?
Well, summarizing 900 pages in 9 seconds, I would say the purpose...
I'll give you 11.
The purpose of the law is to make sure that more people qualify for insurance, can afford insurance, that the insurance they get covers more services such as prevention and mental health, and once they have coverage, that they can be assured that they'll be able to keep it even if they get sick.
Do you agree with that assessment?
Yeah, even at 900 pages, it's an imperfect statute. I think the addition of certain benefits, protections, and rights is an important step forward, but we still have a long way to go.
What do you really have to do to make sure that the plan that you have moving on from one year to the next year is the right one?
It is imperative, given all that's going on, that consumers become more engaged and that they learn not only about what should be part of their care, but maybe some things that may be happening that are in excess, which is a big problem in our country.
What are the most common mistakes that you've seen?
The most common, well, when you're 65, 3 months before and 3 months after, you have this period called the initial enrollment period. Some people make the mistake of not signing up for Medicare Part B when they should, and some people make the mistake of signing up for B when they shouldn't.
That while we talk about visits to see your doctor for a checkup, I think patients like Enola and those of us in the baby boomers should every once in a while have a health insurance checkup.
What is the best way, and I'm sure you've all been through this yourself, trying to cut through the contradictory information you come across?
I would say stick to the facts. There's a lot of heated rhetoric on both sides, good and bad, but that really doesn't matter for consumers. The consumers need to say what coverage will be best for me, and I think equally important, beyond my coverage and what the doctors and the hospitals do, what can I do as an individual to stay healthy, whether it's exercise, diet. We should be in charge of our health.
Join us as we cut through the noise and get down to understanding healthcare.